Are booster shots going to be made available here in BC? We know that Alberta just announced that they're starting to roll out or are moving towards booster shots, third shots for seniors. When could we see that happen in BC, and for whom?
Yeah, so that's something that we've been following the data on for some time. So there's two groups of people that we're focusing on right now. One is that there's been some data that shows that people who have certain immune compromising conditions, so people who have hematologic malignancies, so blood cancers, people who've had a solid organ transplant and are on immune suppressive drugs or stem cell transplant, and a certain class of immune suppressive drugs. There's data that increasingly shows that they don't necessarily develop a response after 2 doses of vaccine, and that a third dose may actually increase the probability that they'll have a good immune response. So it increases it in about 55% of people, which means it's not a panacea. People still have to pay attention, and it's still important for the rest of us to protect those people whose immune systems aren't able to manage as strong an immune response. But the National Advisory Committee on Immunization is looking at those data, as is our BC Immunization Committee, and operationally we're putting together the plans to be able to provide that third dose to those group of people, and I expect that that will happen in the next week or so. The question about when and if a booster is required for residents of long-term care, it's a little bit different across the country, and those are also data that we've been watching very carefully. The National Advisory Committee is looking at it. Our Immunization Committee is looking at it. So far, we are not seeing a diminution of protection across the board in long-term care, but we're watching that carefully, and we need to determine what is the appropriate interval. And it's looking like it may be, because we did most people in residents in long-term care received their vaccine at an extended interval, and we know now that that gives a stronger, longer-lasting protection. So we need to determine what is the optimal interval, and it's probably somewhere, I'm speculating a little bit because I have not seen the latest on the data that they're analyzing. It's probably somewhere around 6 to 8 months. And so that would put us, for most people in long-term care, somewhere around October-ish, which means that we can, so we're gearing up to be able to provide a third dose around that period of time, and it would be, we'd be looking at providing influenza immunization around the same time. So yes, absolutely, these are, as you can tell, questions that we're being looking at the details on. The National Advisory Committee and our BC Immunization Committee are looking at it, and we'll be coming up with our recommendations around the best options and the best timing in the coming weeks. In terms of the rest of us, whether everybody needs a third dose, and I know we've seen countries like in Israel, the U.S. has been speculating about 6 months or 8 months, but we're in a different situation. So again, these are areas where we need to look at the vaccine effectiveness and the protection that it's continuing to provide across the board. We've also started very early on here in BC and across Canada with an extended interval, as they did in the UK. And that, as I've said, it gives us a stronger and longer lasting protection. So we want to make sure that we know the appropriate timing and whether it's needed. Countries like the U.S. and Israel, they stuck to the very narrow window of time for the most part, and so have been focusing on booster doses in people that got their first 2 doses quite close together. So the data that we're seeing right now doesn't show that we need a booster dose yet. It may be sometime in the new year for the average person, starting with age probably. And we're also watching the vaccine manufacturers around modifying the spike protein, for example, in the mRNA vaccines, to more closely match what we're seeing in terms of circulating strains. So this would be similar to what we do for influenza strains that change. So we need to balance all of those factors with the protection that we're seeing, and from the data today you can see that we're still getting very strong protection across the board. And what is the optimal timing with which booster dose? So lots more to come on that over the next few weeks and months.